Good morning. This is Kenya News Update today. We begin with a developing crisis that has gripped the nation's capital. President William Ruto has issued a statement following devastating floods in Nairobi that have left more than 20 people dead, while displacing families and destroying homes and property across several parts of the city. The statement came on Saturday, March 7th, 2026, after nearly 4 hours of torrential rains wreaked havoc. But this is far more than a single day's disaster. It is the opening act of what the Ministry of Health warns could be a catastrophic season, with the ongoing March-April, May-long rains threatening to trigger outbreaks of cholera and malaria, even as cholera already burns through 4 counties. Today, in this 12-minute deep dive, we will analyze the immediate flood response, the looming public health crisis, the government's specific plans to protect vulnerable children, and the critical debate over whether Kenya's infrastructure and disaster preparedness are failing its citizens. We will present multiple perspectives, from government officials to urban planning experts and affected residents. The numbers are stark, and the human cost is rising by the hour. Let's begin with the immediate impact. The flooding on Saturday, March 7th, was not an isolated event but part of a wider pattern affecting at least 11 counties across Kenya. Initial reports from the National Disaster Operations Center, or NDOC, confirm a death toll of at least 25 people nationwide. In Nairobi alone, the count stands at 20 confirmed fatalities. The financial cost is already staggering, with preliminary damage assessments from the Kenya Red Cross estimating property and infrastructure losses at over 500 million shillings. Visualize that for a moment: 500 million shillings in direct damage, and that figure is expected to climb significantly as assessments continue in areas like Mukurukwa and Jenga, Mathare, and parts of Kibera, where informal settlements bore the brunt of the rushing waters. Over 1,200 households, representing approximately 5,800 individuals, have been displaced, seeking refuge in temporary shelters set up in community halls and schools. The Nairobi County government has deployed 120 personnel from its disaster response unit, working alongside 85 officers from the National Youth Service. Their primary task has been search and rescue, with over 40 successful extractions from submerged vehicles and collapsed structures reported in the first 24 hours. President Ruto's statement, delivered from State House, struck a somber but resolute tone. He said, and I quote, "The government stands with all affected families during this difficult time. We have mobilized all necessary resources to support rescue operations and provide immediate humanitarian aid." The president directed the National Treasury to release 2.5 billion shillings from the emergency fund to county governments for response and recovery. However, critics were quick to point out that this fund had been depleted to just 15% of its 10 billion shilling allocation in the last fiscal year, raising questions about its sufficiency. Let's break down that allocation with a visual. The president's directive is a significant move, but context is key. Now, beyond the immediate rescue, a second, more insidious crisis is brewing. The Ministry of Health has issued a dire warning that the long rains may cause a surge in disease outbreaks. This is not theoretical. As of this week, 4 counties, Nairobi, Kisumu, Migori, and Kwale, are actively grappling with a cholera outbreak declared in late February. Dr. Susan Mokish, the Principal Secretary for Public Health, stated in a briefing that floodwaters compromise sanitation systems, creating a perfect breeding ground for waterborne diseases. The ministry's epidemiological data shows that cholera cases in these 4 counties have risen by 72% in the past 3 weeks, with Nairobi accounting for 45% of the new infections. To put this in perspective, let's look at the case distribution. The fear is that these numbers represent just the tip of the iceberg. Contaminated water sources, disrupted garbage collection, and overcrowded temporary shelters create a tinderbox for contagion. The ministry has pre-positioned 50,000 oral rehydration salts kits and 15,000 doses of cholera vaccine in high-risk counties. But experts like Dr. Ahmed Kailbai, a consultant pathologist, argue the response is reactive, not proactive. We have the data from previous flood cycles in 2018 and 2020, Dr. Kailbai told us. The disease spike follows a predictable pattern, yet our prepositioning of medical supplies is consistently inadequate by at least 30%. We are always playing catch-up with a predictable disaster. This brings us to the third critical pillar of the response, protecting the most vulnerable. In a separate statement, the State Department for Children's Services, under Principal Secretary Karen Agingo, outlines specific measures to safeguard children affected by the floods. This is a population at extreme risk. The government estimates that of the 5,800 displaced individuals, approximately 2,300 are children under the age of 18. Within that group, about 800 are under 5 years old, the most vulnerable to disease, malnutrition, and trauma. P.S. Agingo stated, "Our priority is to ensure the safety, health, and psychological well-being of every child impacted. No child should face this trauma alone." The outlined measures are comprehensive on paper. They include the deployment of 300 child protection officers to affected counties, the establishment of 12 dedicated child-friendly spaces within displacement camps to provide psychosocial support, and a partnership with the World Food Program to ensure provision of fortified nutritional supplements for 5,000 children and lactating mothers for the next 60 days. Furthermore, the department is working with the Civil Registration Department to issue duplicate birth certificates for an estimated 500 children who lost vital documents in the floods, a critical step for accessing future services. However, the implementation gap is a major concern. A data point from the Auditor General's report for the 2024/2025 financial year shows that only 65% of budgeted funds for child protection in disaster scenarios were actually utilized, with inefficiencies in procurement and logistics cited as the primary cause. Let's visualize that implementation gap. A shortfall of 35% in fund utilization during normal times does not inspire confidence for a crisis of this scale. Now, let's widen the lens to the perennial debate: infrastructure and urban planning. Nairobi's flooding is an annual headline, yet the solutions seem ephemeral. Engineer John Musuni, former director of urban planning at the Nairobi Metropolitan Services, points to 3 systemic failures. First, the city's drainage system is only designed to handle a 1 in 5-year rainfall event, not the increasingly intense storms linked to climate change. Second, an estimated 40% of the drainage network is clogged with solid waste, severely reducing its capacity. Third, and most controversially, unchecked construction on wetlands and riparian reserves has destroyed natural water absorption zones. "We have paved over our kidneys," Musuni says. "The wetlands around Ngong River and Nairobi Dam that used to absorb excess water are now concrete estates. When the rain comes, it has nowhere to go but into people's homes." The data supports this. A 2025 study by the University of Nairobi's Department of Geography estimated that Nairobi has lost 60% of its natural wetland cover since the year 2000. Conversely, the government's flagship Nairobi Regeneration Program, launched by President Ruto in 2025, has allocated 15 billion shillings for drainage improvement and greening the city. So far, only 30% of those drainage projects have been completed, with the rest delayed by procurement disputes and land access issues. This is a classic comparison of problem versus solution, the loss of natural infrastructure versus the pace of man-made solutions. The debate intensifies when we consider climate change. Kenya contributes less than 0.1% of global greenhouse gas emissions, yet it bears a disproportionate burden of climate impacts, from prolonged droughts in the north to these intense floods in urban centers. Professor Patricia Cammery Mbote of the University of Nairobi Law School argues that adaptation, not just mitigation, needs urgent funding and political will. "Our national and county disaster management laws are robust on paper," she notes, "but they are activated after disaster strikes. We need predictive budgeting, where funds are released based on meteorological forecasts, not body counts. The National Drought Management Authority, or NDMA, has a model for this, triggering support based on satellite vegetation indices. A similar flood early action protocol, piloted in Tana River County, reduced flood-related displacement by 22% in 2025. However, scaling it nationally has been hampered by bureaucratic silos between the Meteorological Department, the NDOC, and the Treasury. Let's examine the bureaucratic challenge through a simple organizational chart. This fragmentation slows decisive action. Now, let's hear from the ground. In Mukurukwa in Jenga, resident Mary Ashino, a mother of 3, described the moment the waters rushed in. "It was 9:15 p.m., the sound was like a roaring engine. Within minutes, water was above my knees. We grabbed the children and ran. Everything else, the mattress, the school books, the little shop I had, is gone. She is now at a temporary shelter with 150 other families. While grateful for the food packets, her immediate concern is safety for her daughters and the fear of disease. The toilets here are overflowing. We are drinking water from Bowser trucks, but is it clean? My youngest has had diarrhea since yesterday. Her story is not unique. It highlights the chasm between high-level policy statements and the gritty reality of survival. Community-based organizations, often the first responders, report being overwhelmed. James Omondi of the MTA Rescue Initiative in Mathare says they used their own funds to hire 2 boats for rescues before county teams arrived. We are the early warning system and the first response, but we have no budget, no equipment. We are reacting with our hearts, while the system reacts with paperwork. This raises a critical question about the devolution of disaster management. County governments, empowered by the 2010 Constitution, are the first-line responders. Yet an analysis of county integrated development plans shows that only 5 out of 47 counties, Mombasa, Kisumu, Nakuru, Garissa, and now Nairobi, have dedicated line-item budgets for flood preparedness exceeding 2% of their total budget. For most, it's an afterthought, lumped into vague environmental management votes. The national government's role then becomes one of bailout, a cycle that fosters dependency rather than resilience. The Council of Governors has previously requested a 50 billion shilling perennial mitigation fund, but negotiations with the Treasury have stalled over accountability mechanisms. So, where do we go from here? The path forward requires a multi-pronged, honest assessment. First, the immediate humanitarian response must be fully funded and efficiently executed, with transparent tracking of the 2.5 billion shilling emergency release. Second, the public health offensive must begin now, not when cholera cases hit 1,000. This means mass vaccination campaigns in hotspots, guaranteed clean water trucking to all displacement sites, and mobile clinics. Third, the child protection measures outlined by PS Agingo must be implemented in full, with real-time monitoring to prevent child trafficking or exploitation in the chaos. Fourth, and most crucially, the long-term infrastructural and planning failures must be addressed with political courage. This means enforcing laws on riparian land, investing in climate-resilient drainage, and truly integrating disaster risk reduction into every county's development agenda. President Ruto's statement is a necessary first step, but history will judge this administration not on its words during the storm, but on its actions to prevent the next one. The coming weeks of the long rains will be a severe test of Kenya's systems, its solidarity, and its resolve to build a future where citizens are not hostages to the weather. The numbers tell a story of loss and challenge: 25 lives, 5,800 displaced, 500 million shillings in damages, a 72% rise in cholera cases, and a 35% implementation gap in child protection. The question for all leaders, from the president to the county assembly member, is what story the numbers will tell next year. Will they tell of resilience built or of a cycle repeated? For Kenya News Update today, this has been a 12-minute deep dive into the Nairobi floods crisis. We have presented the government's position, expert critiques, and ground-level realities. The downpour has paused, but the real storm of recovery, disease prevention, and systemic reform is just beginning. Subscribe to Kenya News Update today for continuing coverage.